Okay, we are live now. Good evening,
Alright,
everyone.
thank you.
I'm Dr. Hita Patel from Digital Media Team. I'll be hosting today's webinar being organized by Telangana State. The Indian Association of Physiotherapists is an oldest and largest association representing physiotherapists in India since 1955. The IAP Digital Media Team consists of group of physios who handle the Zoom platform, webinar live streaming, and IAP profile on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow the IAP profile on this social media to receive the notification for events such as webinar, workshops, CMEs, conference, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In playlist section of this channel, webinars are segregated into various folders on the topic of orthopedics, neurology, sports, fitness, pediatrics, cardiopulmonary, women's health research, and cancer rehab for the easy access. The social media link will be shared in the chat box shortly. Over to you. Over to
Breastfeeding
Telangana.
is
Yes.
yeah. Breastfeeding is nature's perfect start. And with the right support, it can be a journey mothers enjoy, not endure. Good evening, everyone, and a warm welcome to this special webinar. I am Dr. Vishali, a certified musculoskeletal and rehabilitation specialist, yoga protocol instructor, and owner of PhysioPlus Advanced Physiotherapy Yapral, Medchal District, and coordinator of Medchal District. I am pleased to introduce our Medchal Malkajgiri District team coordinators and organizers, Dr. Reshmi Prajapat, Dr. Vedavani. Together, we are committed to promoting awareness, education, and empowerment in women's health through the Indian Association of Physiotherapy Women's Cell Initiative. Today's webinar prioritizing breastfeeding, creating sustainability and support, focusing on an often under-discussed but critical part of maternal and child health. Breastfeeding not only provides the best start in life for infant, but also has profound health benefits for mothers. However, sustaining breastfeeding can be challenging due to physical discomfort, fatigue, postural strains, and recovery needs after childbirth. Through physiotherapy, we can help address these challenges, improving posture, reducing pain, supporting recovery, and empowering mothers to continue breastfeeding with confidence and comfort. It's my honor to introduce Dr. Madhuri Kasi, the Telangana State Head of Indian Association of Physiotherapy Women's Cell. Under her dynamic leadership, the Women's Cell has been working tirelessly to bring important women's health topics to the forefront, and her guidance continues to inspire our work. Next. And then next, Praharsha ma'am, Dr. Praharsha. Next, she is the
I request Dr. Madhuri to kindly introduce IAPWC. Ma'am. Okay.
Praharsha, you can do that. Okay.
Good evening, everyone. A wonderful webinar, very important and wonderful webinar, which is not only useful, but a very, very important topic in women's health. I congratulate all of you for your interest and thank you for joining this webinar. IAPWC Women's Cell, the wing of Indian Association of Physiotherapists, was started by and under her guidance, there have been been conducting different awareness programs, empowering women and also supporting women physiotherapists and different women in various aspects. So I congratulate and welcome the entire team, and I wish you all the best in this journey. Thank you.
Thank you so much, ma'am. So I will speak about the obstetric physiotherapy in short. Hello, everyone. I'm Dr. Prahasha. I'm a musculoskeletal physiotherapist, certified obstetric physiotherapist also. And I have been practicing for more than 7 years now. Recently, I am privileged to join IAPWC Telangana team. So let me start with a discussion regarding obstetric physiotherapy. Have you ever thought of a pregnant female who is trying for a vaginal delivery? What all is required for vaginal delivery? She is wondering about all those criterias. She has lots of questions regarding her delivery. She asked few to her gynecologist, but many are left unanswered due to the numerous factors. Since there is a delicate stage, this is a delicate stage where the would-be mom is apprehensive about everything she does. People around her are telling her to be extra cautious, and if she has lost a baby previously, then more to that apprehension. So, in this situation, rather than just telling her to practice few exercises, if someone can personally guide her through her practice at least few times a week, then would it be better for her or not? Yes. Then, what if that person who is helping her knows when to stop the exercises and refer her to a gynecologist? If she can assess her for any of the complications, and if she can relieve her of her pains while practicing those exercises, that is an obstetric physiotherapist. She can make a vaginal delivery happen and she can take care of the new mother post delivery too. She can guide her how to do breastfeeding while avoiding the pain. The correct posture required and the other guidance can be given to the new mom as per evidence-based clinical guidelines. I always keep updating myself with latest clinical guidelines, and now we have the same for obstetric physiotherapy also. We are sharing the link for the clinical practice guidelines in the chat box. Kindly go through it and let us know if you have any queries regarding it. Now, I am privileged to introduce our resource person, Dr. Vinoda. She is an experienced she is an experienced lactation consultant, Lema's childbirth instructor, Mary Mongan method certified hypnobirthing practitioner, certified to give professional support during labor, member of BPNI, Breastfeeding Promoting Network of India, obtained credits from International Lactation Consultant Association, and external assessor at various hospitals to be awarded as BFHI, Breastfeeding Friendly Hospital Initiative Accreditation, guided PHCs, Government Hospital Gajwel, Government Hospital Khammam, and Ankura Hospital Boduppal to successfully achieve BFHI accreditation. She regularly conducts fitness and ergonomics classes for moms in corporates and hospitals. She also writes health articles to magazines, health talks in social media. Welcome, ma'am.
Thank you so much, Prahasha, for the warm welcome.
So let us start the session, ma'am. Let us begin by laying the foundation with global recommendations and why breastfeeding is considered so vital for mother and baby. Based on the current WHO and UNICEF guidelines, what are the standard breastfeeding recommendations, ma'am?
So, as Dr. Prahasha, you had mentioned earlier when you're talking about obstetrics, physiotherapist, and our role comes in to understand the basic clinical guidelines regarding the standards of breastfeeding as well. And
Yes.
you had mentioned that there are lots of myths and advices coming into a new mom. It is
Yes.
very important that we, in this webinar, the first point we are discussing are these standard points: what the WHO recommends, what the UNICEF recommends, and what is followed around the world. So
Yes.
the standard principles that are needed to be followed are: immediately after birth, the initiation of breastfeeding should be happening. So
Yes.
it is called as the golden hour. So within
Yes.
the first hour, the breastfeeding should be happening, the initiation.
Hmm.
The continuation of breastfeeding exclusively should happen for 6 months.
Hmm.
And then it should be continued along with complementary feeds for up
Hmm.
to 2 years of age.
Hmm.
Can you guess what is the average breastfeeding age of babies all around the world? It is
3 years?
approximately, it is around 6 years, and
My.
it's a big surprise for us because in India we are still struggling for 6 months to 2 years, right? So there is a
Yeah.
lot of scope for improvement for all these things.
Wonderful, ma'am. So, given its recognized role in infant and maternal health, what are the proven advantages of breastfeeding and breast milk, Dr. Vinoda?
So there are lots of advantages of breast milk for the baby. Firstly, it is a complete meal for the baby. It is the optimal nutrition that every baby needs, and it is the right of the baby to have the food from the mom. Right.
Yes.
So this basic right is sometimes disturbed by different practices in the hospital or by the family members,
True.
maybe because of ignorance and lack of knowledge and
Yes.
awareness
Yes.
as well. So the important benefits of breast milk are: it is highly nutritious
Hmm.
and then highly immunological, and it
Hmm.
helps prevent the baby from acquiring any infections,
Hmm.
like pneumonia, infections like ear infections, or
Hmm.
respiratory allergies. And in
Hmm.
further life they will be help this breast milk will actually prevent them from getting diabetes, hypertension, the lifestyle diseases. So babies
Yes.
who are breastfeed have the extra benefit of pushing those diseases away. Apart
Hmm.
from that, there is a higher IQ in babies who are taking breast milk
Yes. True.
than
True.
in babies who are depending on other methods like formula or any other cow's milk, which is actually prohibited, but still these practices are continuing. And regarding the benefits for the mother is going to have a lot of benefits with regards to her own weight loss and
Hmm.
bonding with the baby, and also preventing ovarian cancers and uterine cancers.
Hmm.
It is cost effective and it is less tiring, and she can relax really well if she's breastfeeding.
Yeah, now that everyone is concerned with the weight loss post pregnancy,
Yeah.
so if simple act of breastfeeding does help with weight loss, then everyone should at least try it. Yeah. So that was very informative, Dr. Vinoda. So, ma'am, colostrum is often referred to as liquid gold in neonatal nutrition. So, why is it given this name?
Colostrum is usually yellow in color, though it comes in all different colors like watery milk sometimes, or sometimes it is greenish tinge, or sometimes it is pinkish or reddish in color. It
Hmm.
varies from mother to mother, and
Okay.
it varies from day to day as well.
Okay.
But most often it is slightly yellowish in color like gold, and that is one of the reason why it gets
It
its
is called
name.
as
But
gold.
most primarily because we consider gold as very valuable, you know, in any part of the world. And the immunological benefits that the colostrum gives is like we can call it as vaccination for lifetime for the baby.
Wow.
So that is the reason we call colostrum as liquid gold.
Wow, very well quoted, ma'am. It is a lifetime vaccination for the baby. We should remember it. So, Dr. Vinoda, in the context of newborn feeding practices, what are the prelactal feeds and how can they negatively impact the infant health? Can you please explain?
Okay. Prelactal feeds can be solids or liquids that are given prior to initiation of breastfeeding, which we are talking within the first hour. We want to initiate breastfeeding.
Yes.
Sometimes this may be delayed till the mom is, shifted to the ward. Meanwhile, the grandparents or some, because of the traditional practices in lots of places, the prelactal feeds are being given. Prelactal feeds might cause infections to the baby. It delays breastfeeding. And also it alters the glucose levels of the baby. So sometimes the glucose levels suddenly rise up high and then fall down. So it alters the glucose balance in the baby.
Yeah. So we should avoid prelactal feeds completely.
Yes.
Okay.
So
And
some
even
of
if
the prelactal feeds include honey, sugar water, so glucose water. So so all these should be avoided completely.
yeah, these are actually very general practices.
Yes.
Our elders keep telling us that no problem, you can feed this, no problem, we can feed that.
Yes.
Yeah. So yes, we should understand the science behind it and take actions and try to convince them also, because the elderly needs to be convinced.
Yes.
Yeah. So coming to the preparation and the technique part, ma'am, once we understand the importance, the next step is preparing the mother and ensuring the correct feeding techniques. Before initiating lactation, what essential physical and psychological preparations should a mother undertake for successful breastfeeding? I think very important part this is.
Yes. And as physios, we know we suddenly jump into just the physical part, but there is lots of emotional part
Yes.
attached to this portion
Yes,
of
yes.
breastfeeding, especially
Yes.
because having a baby and your whole life is going to be something different from then onwards. You may have to dedicate a lot of time
Yeah.
in your entire day to catering to the needs of the baby, especially breastfeeding and caring for the baby. And definitely it alters. If she's a working mom, she has to make arrangements so that if she can work at home or she can take leave, and she has to make some options to call in somebody for help. So lots of these adjustments should be happening. So mentally, when we speak about these things, it is very taxing for a new mother. It is very new for her. Nobody is going to be in her shoe and think about her needs. General advice is definitely thrown. Yes, everybody gives. But when it comes to practicality, there are lots of challenges. And husband can be a right person for support. And family members need to understand the needs of the mother. And mother should be ready to take support from them as well. So emotionally, she will be much more stable, because post-delivery there will be withdrawal of hormones, and sometimes the mothers may experience baby blues as well. It may lead into depression if she's in a situation where she can't share her issues at all. Probably the breastfeeding issues, she might be doing good if she's joining a breastfeeding group, or she's taking a lactation consultant, or she's taking support of her sister who is breastfed. So this kind of support system is very much needed for the mother. When it comes to physical part preparation, we recommend all mothers to be physically fit, right? And have a wonderful posture when breastfeeding. Learn the different breastfeeding postures in the antenatal class. Definitely maintain good arm rest, because she'll be carrying the baby. And I do observe from all these years, from past 18 to 20 years, I've been observing that when the mom is doing exercises in pregnancy, most often she's concentrating on her belly, lower body. The upper body is usually neglected. But here, when it comes now, a baby of approximate 2.5 to 3.5 is an average Indian baby weight. She is going to hold that baby for 12 times, half an hour for breastfeeding, then burping and cuddling and all that. Do you think her hands will be able to support this strenuous act without being
So suddenly she'll be having
physically fit?
pains.
So definitely concentrate on that. And because of the heaviness in the size of the breast, her posture changes. And if she's not aware of the breastfeeding posture needs to be like that, I have seen lots of mothers who shrunk in like this, like this. It's very difficult for them to come up like that. So it's very important that from the beginning, she's toning up her upper back muscles, neck muscles, trying to learn some relaxation exercises, stretching exercises, because definitely holding like this and feeding for a long time, otherwise catering for the baby, will definitely involve the muscles over here, doing some breathing exercises. Okay, so all these kind of preparation can be done by the mothers. And
Yeah.
especially maybe positions for labor and all these things are very important, and how husband can support through the pregnancy journey, through the labor, through the breastfeeding should be given importance.
Yeah. Okay, ma'am. So you have explained the breastfeeding technique too very well. So the key of this answer is everyone should focus. All the mothers should focus on their upper limb strength also. They should practice some exercises. Very nice, ma'am. So in early infancy, what are the recommended feeding approaches, and how can mothers recognize the cues that indicate their baby is hungry, ma'am?
Feeding approaches, like we discussed, the posture and all should be really good. She should try to maintain the, what is the second question, Dr. Prasha? Didn't get you.
How can mothers recognize the cues that their baby is
Cues
hungry?
of the baby. Yes, this is
Yes.
very important because
Yeah.
initially the mom may not understand that baby is hungry. Most of them tell me that I have attempted breastfeeding, but baby is very sleepy. It's very difficult.
Hmm.
They come with so many complaints that we are not
Hmm.
able to wake up the baby. So
Hmm.
I do teach the mothers that you have to learn the technique to wake up your baby as well,
Yes.
and understand the feeding cues as well.
Yes.
So early hunger cues are, if the baby is trying to turn the face to the side, okay,
Hmm.
and trying to put the fingers in the mouth, or trying to do the sound, slurping sound. So all these are early hunger cues. The late hunger cues are like baby started to cry, shrill cry,
Hmm.
and this is a complaint from the baby that Mama, I have been showing the signals and you haven't responded. Now I'm angry.
Yes.
So
I
this
need
time,
attention.
yes. And baby may not immediately latch. You have to soothe the baby, cuddle the
Yes.
baby, talk to the baby, and then
Yes.
slowly it will agree to do the breastfeeding. So it's always important that we teach the mother how to wake up the baby as well. One important thing they can do to wake up the baby is to undress the baby just for a
Hmm.
minute or so. They will feel
Yes.
uncomfortable and then cover
Yes.
the baby and bring the baby to the breast. So that's one way you can do, or some, or sometimes little fingers sucking by the baby. If you put your little finger into the mouth of the baby, of course, it should be a very sterile one.
Yes.
If you do that as well, babies would want to suckle because wherever you touch, the suck reflex gets elicited, right? So once a baby is slightly alerted and you do this, baby will show more signals to, more interest to come for breastfeeding.
Okay. Wonderful. Wonderful technique, ma'am. Everyone should note this down. And coming to now the practical challenges. Now let us look at how we monitor the feeding success and handle some of the practical challenges mothers often face. From a clinical perspective, how can a mother assess if her baby has received adequate milk? And what are the key signs of effective milk transfer? Again, very important question.
So adequate milk, mostly 95% of the mothers from the past 20 years, every mother that I have seen had informed me that they do not have adequate supply. In spite of them having good supply, this is because the mother doesn't know, because she's not able to see into the breast. She will not
Yes.
know how much she's producing. And
Yes.
she can't peep into the baby's tummy. Obviously, she wouldn't understand how much is there.
Yes.
So there are indirect ways of checking it, but preparing the mother with information is the key to successful breastfeeding. I say that breasts are not the actual organs for breastfeeding, it is the mind.
Yeah.
If the mind is prepared, then
Wonderful.
everything goes well, right? Because the
Yes.
body is already prepared. Pregnancy and breastfeeding are not two separate journeys. It is a continuum.
They are
So
wonderful.
definitely once the mother is pregnant, the hormonal changes are going to happen. And during pregnancy itself, there are lots of changes in the breast. There is increase in size of the areola, right? So this is
Yeah.
an indication that baby can identify the breast easily. Normally babies can't see whether it is, even if you put a makeup and deliver your baby, take the baby next to after the delivery, your baby may not see your makeup, but definitely can identify if it is a black and white combination.
Yes.
So that is how the breasts are designing to help the baby to see. It's like a bullseye, a black dot on a white background of the breast. So that's how the preparation is going on. And the hormones too. The hormones also help in increasing the glandular cells, the proliferation of the tissues over there, the fatty tissue gets increased in size, glandular cells get increased in size. This helps in preparation. That is the reason why the breasts are growing in size, right? These are the changes the body is doing already. And milk production is by demand supply. Whenever the baby is latching and taking, then the milk supply is going to come in. It's not the other way around. Most mother think that the breasts are not heavy yet, so I don't have milk, so I will feed once the breasts are heavy. So that's the wrong approach to go. Educating the mothers and showing them the right ways of holding the baby and latching will definitely help them.
So okay, so I think we should first ask the mother to differentiate between her perspective that she is not able to produce enough milk and the reality. She should check is with the scientific ways, and then she can make out if
Maybe we
she
can
needs
educate
consideration.
her more regarding the number of times she has to breastfeed as well.
Yeah.
Right? At least minimum 12 times. Most mothers do not understand that their baby's tummy is very tiny, and that is why they produce very small amount of milk in the beginning. When I ask them like how much do you think you want to produce, sometimes they even pump and check.
Yes.
We don't know, but they say that this amount is less. So I keep telling them that you observe yourself. How many times do you eat? Obviously 3 times, 4 times.
Yeah.
But how many times the baby is supposed to eat it? 12 times. The tummy capacity is so small, it can't hold more than a 2 ml, 5 ml in the beginning days. So if the mother is shown the size of your baby's tummy is just the size of your eyeball, definitely she would understand, okay.
Yes.
But still
Most
she's
level will
doubtful.
come.
Yeah, but still she's doubtful. I want to know how the feeding is enough or not. Because sometimes the baby is crying. I always think that my baby is not got enough from me. How will I know? Because I want them to understand hunger is not crying is not a hunger cue all the time.
Yes.
Crying is a communication
Definitely.
by the baby. It can mean that baby is sleepy or baby wants to come to you or baby has peed or anything of that sort.
Crying can be like a very wide umbrella. Like it can, the baby just knows how to communicate. That is only way the baby can communicate. Yes.
And that is one more thing. The latch should be correct. If the mom is able to give a nice deep latch, she is able to understand what is a deep latch and a shallow latch, then she would become little more confident. And making sure that the breastfeeding session is lasting at least for half an hour without much pauses during the feeding session. That should not happen. And also putting cloth nappies and counting the number of urines by the baby
Very important.
is the wonderful result. Most times mothers are happy seeing the urines because we have encouraged them to observe the urines, and if the urine count is not good, just let us know. That is one way she becomes more confident also. Yes.
Nice. So what if the baby falls asleep on the breast within first minute of feeding, ma'am? What practical strategies can help maintain the effective breastfeeding?
I think I can show it with the baby with me over here. Okay.
Yes, definitely.
So the mom is holding the baby this way.
Okay.
Yeah. Holding the baby this way. The most important thing, I want the baby to be in proper alignment, hip, shoulder, and the ear lobe to be in straight line.
Okay.
So that is a good alignment for the baby. This hand down can be tucked in or it can be around. And making sure that mother is stimulating the ears like this. Okay. Or just holding the breast here, compressing the breast once in a while. Right? And if the baby is fallen asleep, unlatch and relatch again. Or taking deep breaths. When mother is taking a deep breath, little more of the milk goes in, or little more of the nipple and areola goes in. That will alert the baby. or at any other point on the body, disturb the baby. So these are different things that mom can do to make sure that the feeding session is lasting at least for half an hour without the baby sleeping in the first minute or even later.
Okay, okay, wonderful. That was a practical depiction. So, during the lactation period, what common challenges do mothers encounter while breastfeeding? Like a very short description.
Definitely. We think that breastfeeding is a natural thing,
Yes,
and as educated mothers and living in cities and working, we know the environment we are placed in.
yes, ma'am.
We do not have ample help by experienced people. Maybe our sisters who are delivered, they are staying in their hometown. Maximum they would come and help for a day or two, not more
Two,
than that.
yes,
Yes.
yes.
So the mother should be knowledgeable about a deep latch. Right. So a deep latch will ensure that the baby is fed well,
Okay.
right? And that is the way she can continue the breastfeeding for long. Otherwise, baby would unlatch and fall asleep.
Yes.
Yes. So these are different things. As a mother, she should be knowing for herself rather than depend on somebody else.
Nice. So latching is very important
Very important.
for us to understand the amount of milk which is going in there.
Yes.
So, support plays a huge role, ma'am, in breastfeeding success from family, healthcare providers, and even the policy frameworks. When milk supply is inadequate, what evidence-based counseling approaches can help support the mother? Dr. Vinoda?
Most often, it is very rare that mothers do not have milk.
Okay.
1 in 1,000 mothers might have an issue with milk production, but it is usually the perception of low milk supply by all the mothers
Yes.
that we have discussed earlier.
Yes, yes.
That will be the reason.
Okay, so the perception matters. So the psychological preparation of the mother is the most important thing you want to say.
Yes.
Okay, beautiful. So now, considering the barriers many mothers face, what evidence-based strategies can be used to encourage the breastfeeding? You already answered
I
those.
think we missed on discussing the challenges that breastfeeding mothers face. You have asked me that question, and I think I have explained regarding the latch. So, when the
Yes.
latch is not deep, she might experience nipple pain, right? And
Yes.
this nipple pain doesn't mean that, okay, I'm a mom, I have to bear the pain, let me feed the baby.
Yeah,
No,
that is very
feeding is
simple.
not happening actually. Milk transfer is not happening actually.
Yes.
Nipple feeding is the reason for this pain. So nipple is being held by the baby, not the areola, where the glandular tissue is there, where the milk ducts are there. So that
Yes.
is the area where the latching should be there. So
Hmm.
nipple feeding means that you are putting a straw in an orange and trying to suck the juice of it. Obviously, you will not get
Not possible,
anything,
yeah.
right? So a proper latch will ensure that most of the challenges can be prevented. And if this is continuing, she might end up with engorgement of the breast, heavy breast, because milk is not removed properly. Mother may experience fever, chills, headaches, radiating pain, upper back pain, lots of these things. And this engorgement, if not taken care of at the right time, she may be going into mastitis or maybe abscess, or even maybe a surgery needed. So these are some of the common challenges from the mother's end. From the baby's end, the baby might be having a oral thrush or a tongue tie that is actually disturbing the breastfeeding.
So they should not wait for long, and if they have any pain, they should definitely meet a consultant, a
Yes.
lactation consultant, so that they can be properly guided. So, from a public health and policy perspective, ma'am, are there any legal acts or regulations in place to support the breastfeeding mothers?
Yes, definitely. Mothers need to know what are their legal rights, especially working mothers.
Yes.
Maternity leave is something which we advocate strongly for mothers, so that breastfeeding is also going on well.
Yes.
And The workplaces also should be considerate to the mothers who have recently delivered. If there is a choice that can be given, something like a work from home should definitely be given that option. And for mothers who cannot work at home and they definitely need to be physically present, frequent breastfeeding breaks is one more important thing that they need to provide. And mom can put a request letter to the workplace management that she needs a separate room if she's a pumping mom, especially. And if the employees are more than around 50 people in the workplace, it's important that they provide with a crush for the baby as well.
Yes, yes. So do you
And a
suggest?
paternity leave of 15 days
Yes.
is also something to remind of.
Yes. So, do you suggest that a lactation consultant should be there on call in corporate setups so that the new moms can be helped or they can be guided when they are in the office only because they might not get enough time to
Yes.
consult?
Yes, definitely. That's will be a good option. But sensitizing the mothers with their workplace antenatal classes is the first priority so that she will be prepared and she will know whom to approach from the beginning of a pregnancy. That can be followed with other consultations whenever there is a need-based availability can be provided.
Okay, so now with this beautiful discussion, we have come to the end of the discussion, ma'am. So I would like to wrap up our discussion and leave the audience with a lasting thought. So summary from my side is guidance and awareness are the 2 points to be noted here. Breastfeeding is the best gift you can present your child. It gives lifelong immunity and bonding with you, with many other benefits also, especially in the first hour after the birth. And for the students who want to have further guidance regarding a career in this field, kindly get in touch with Dr. Vinoda through any of our team members, and she will be happy to guide you. Yeah, so thank you so much, Dr. Vinoda, for being there with us. This was very enlightening. I also enjoyed the session. Yeah, truly enlightening.
Thank
Thank
you
you
for
so
the
much.
wonderful questions. It was really nice.
Thank you. So now I would like to welcome Dr. Reshmi, one of the coordinators of Medchil district. Dr. B. Reshmi Parjapat is a committed and a driven young woman making her mark across multiple fields. She is a dedicated physiotherapist, an expert exercise physiologist from Sports Authority of India, and she is also a medical bioinformatician. She is currently working at Government District Hospital, Medchal, Malkajgiri, as a clinical physiotherapist. I welcome you, Dr. Reshmi.
Thank you, Dr. Praharsha. I appreciate your warm welcome for this. Yes. So before we are ending the session, I request Dr. Vinoda ma'am to clarify a few questions. I can see in the chat box. Shall I ask Dr. Vinoda?
Yes, please.
Yes. Okay, ma'am. Thank you. So there's one participant asking that is there any hospital for internship in obstetric physiotherapist?
Um, See, we haven't identified hospitals, but as an individual person, I can help you out, reach and understand your needs, and we can help you with that.
Okay. Okay, ma'am. And there is someone who is asking that attitude differences between MPT ortho, MPT neuro, and MPT obstetric. I think this student is like she's in her graduation and now she wants to do her masters, and
Yes.
she's finding it's difficult.
Yes,
So
this is a wonderful field, obviously. This is a place where you can see new life being welcomed onto the earth. I feel privileged to be part of this field, definitely. It has really brought immense joy, and it would always remind me of my birthing journey with my babies as well. And I am so happy to cater to other mothers' needs. The reason I have become a lactation consultant itself is, I did face a lot of challenges during my pregnancy journey and lactation journey as well. So definitely, you will be part of their family if you're helping a mother. They wouldn't leave you, and they will show a lot of gratitude. And I would definitely encourage, students who are interested, to work in the women's health. Obstetrics is definitely a good field.
Yes, I think this is definitely a upcoming good field, ma'am. Yes,
Yes,
exactly.
yes.
So, if there's other question, ma'am, stating that if the baby is feeding only on one side and it's painful, then how to avoid it?
Okay. How to avoid the pain? Please make sure that mom is taking some ice pack on the area wherever it is painful, and try to apply nip care cream if it is a sore nipple. But the solution is, if the baby is doing a correct latch, the pain will subside.
Okay.
Okay?
Yes. Okay, ma'am. Okay. The other question is, what are the prelactal feeds, ma'am?
Prelactal feeds are honey water, glucose water, or sugar water. In some places, it might be something else, something auspicious, they say, and from the puja room they get it. So it can be plain water also sometimes. So we have to avoid all these things.
Okay. Yes.
I think I missed on your question, Dr. Reshmi. When asking, the mother was also feeding only on one breast.
Yes, ma'am.
Yeah. Oh, I would also ask her to go for an assessment. Why she's not able to feed on the other breast? Is what is the challenge that she has also to be assessed.
Okay, ma'am. Like it's better. Like I'll ask her to get back to us at least after the session also. So, and there's another one who is asking, like, hi, ma'am, I'm a clinician practicing in a clinic in Secunderabad. I faced a lot of pain during my initial breastfeeding sessions. So, can I know how to avoid the pain completely? Many working females are doing breast pumps for expressing milk. So, do you recommend that?
Okay.
Like, hmm,
So pain is one thing we already discussed. It's obviously because of a shallow latch.
okay,
And we have to tell the mother again and again. I know she's a physician,
okay,
she's into the medical field,
yes,
but any mom is a mom, whether you're a doctor or an engineer or an actor or anyone in any profession. When you become a mom for the first time, you will have your own set of challenges. So
yes,
please do meet a lactation consultant and try to address this pain by correcting the latch. And sometimes the pain is caused by breast pumps as well. If the flange size is not good, if the suck pressure is not good, definitely it will. And the way you are using it on the breast is not good. If you're skipping on the massage mode and directly trying to extract milk, so all these things might cause a lot of pain for the mother.
okay. So nowadays in market there are like two types of pumps also I'm seeing like manual pump and also
Electric
like
pump.
electric
There
pump.
are so many variations. There are so many. There is something called as a Hakka breast pump, double electric breast pump, hands-free breast pump. There are lots of breast pumps coming up,
Okay.
and
So is
different.
it advisable ma'am to use breast pumps or something like that?
Definitely, definitely breast pump, but you should use it judiciously. Anything can be used judiciously, will have a proper effect. Otherwise, I mean, if the mom is at home and she's been only pumping and feeding, then baby would refuse coming to the breast because baby gets used to taking from the bottle and the spoon. If it
Yes.
is a working mom and baby is already grown and 6 months plus the baby is, so that baby would understand, okay, mama is away, I take from somewhere else. Mama is coming back, so I take from her.
Oh,
So definitely for breastfeeding mothers, especially who are working, it's a great gift. Pumps are a great gift.
okay. Good. 1 second. Yes. What is DHA since ma'am?
DHA is fatty acid, docosahexaenoic acid. It is present in the breast milk.
Okay.
This is one of the omega-3 fatty acids which help in brain development. The IQ of the baby is going to be more if the baby is breastfed for this reason, because of the DHA.
That's what, like, nowadays, other milk powders also we are getting for the babies, I believe, just to, excuse me. Dr. Vinoda? I think there is some
Some technical issue. Yeah.
yes, I think technical issue. We'll wait a minute or so that, like, we'll wait for the ma'am to join back. Till that time, if anyone have any questions, you can put in the chat box. Ma'am will be available. We can clarify questions. Thank you.
Ma'am is available now?
Yes, I'm available. Hello? Hello?
Hello.
Dr.
Yes,
Rashmi, can you hear me?
yes, ma'am. I can hear you.
Yes,
Shall we continue,
yes.
ma'am?
Yes, please.
Okay. Good to see you, ma'am, back.
Sorry.
Okay, it's okay, ma'am. Okay. The next question is, sometimes mothers feel that one breast is smaller than the other breast. So, can I feed the baby from both the breast, or only they have to maintain on the breast which is bigger size? Ma'am?
Yeah. See, most of us don't observe clearly, but most of us will have different size of breasts on both the sides. Slight difference will be there in the shape and the size of the breast. So it shouldn't be a matter actually. And thinking that to avoid feeding on one breast will actually cause more engorgement and breast lumps and abscess on that side if you're not emptying the breast well. Supposedly, the breast is not forming lumps. At least it will shrink in size because there is no demand on the breast. The size will slowly shrink away, and the breast that you are breastfeeding will increase in size. So please never do that. Always one feed on one side, especially after day 3. We recommend breastfeeding should be, one breast at a time, and then the next feed should be definitely on the other breast for the next breastfeeding session.
Okay, ma'am. Next question is, hi, ma'am. Nowadays, in the fast moving world, moms are using breastfeeding machines and store milk and they give. Will you encourage this, ma'am? And what about the bonding with the mom?
See, breast pumping is definitely good, especially sometimes babies are in NICU. So these babies cannot be breastfed, maybe because they are preterm, maybe they are on ventilators, sometimes they are on oral feeds, but to be in the NICU. And for these reasons, moms should not be prevented from pumping. Pumping will allow this mother to produce enough milk. By the time the baby comes to her from NICU, she will be ready to breastfeed. She will be able to maintain her milk supply and provide this nutrition even though baby is separated from her. So definitely we should encourage pumping mothers. We have to explain the pros and cons to mothers whose babies are not critical, who is not working, and we have to understand what their need is and counsel them accordingly.
Yes, ma'am. The next question is, does massage affects on breast milk to increase the milk, ma'am?
Definitely, physical massage definitely enhances milk production. It also helps in loosening up the milk that is there in the breast, which will help the baby to easily pull it out.
Okay, okay, ma'am. Light exercise is good for postnatal care. Is it so, ma'am?
Wait, what is it?
Light exercise is good for postnatal care.
Definitely. Exercise has benefits all the time. Only thing, taking care of the sutures, giving her enough rest in the very initial days is important. And start with slow exercise, low intensity exercise is important, maybe once the mom is comfortable.
Okay.
We recommend exercises after 6 to 8 weeks after delivery.
Okay. Like, is it like 6 to 8 weeks is just for general exercise also, ma'am?
General exercise, but we do teach bed exercises immediately after labor.
Okay.
Immediately, I mean, day one, day two, post op also. At
Okay.
least start with ankle toe exercises. As physiotherapists, we all should agree on the
Yes.
basic bed exercises, even though she's not coming out of the bed.
Yes, yes, ma'am. How lumps are to be dissolved if mom is not feeds more than hours?
Maybe the lumps she's asking if the baby is not breastfed and she's feeling heavy, that kind of lumps. So breast massage will definitely help, and compressing the breasts like this to prevent the leaking can be helpful. Wearing breast pads can be helpful to help the mother control the leaking of the breast. Physical massage, breast massage techniques can be taught, and obviously, as physiotherapists, we know regarding the benefits of lymphatic drainage, definitely to be applied on the breast as well.
Yes, yes, ma'am. So, yes, I think we are almost there.
Good.
Yes, done. Done, ma'am. Thank you for your questions.
Most welcome.
Also, is there anyone? Yes, ma'am. There's one more question. Is there any connection? Like, shall I, ma'am?
Yes, please.
Yes. Is there any connection between breastfeeding and neuroendocrine reflex lag between mother and child?
Definitely, there is a feedback mechanism. Okay, if the baby is feeding at the breast, there is definitely the saliva entering into the nipples as well, which is like carrying a message from the baby regarding the needs of the baby into the bloodstream, and this reaches the brain, and the brain responds accordingly. So, if it is a preterm baby,
Okay.
definitely that mom's milk is very different from the mother who had a term baby. This
Okay.
baby, preterm baby, has come out much before the due date, and
Okay.
they usually do not gain much weight. Weight gain is more once the baby's growth is finished, and then the weight gain happens. So, in the last few weeks, the baby is not present in the womb, baby would have missed that fatty tissue in the body. So,
Oh,
this fat increases, the baby staying in the womb. So, once the baby is out as a preterm baby, this
yes.
mother's milk will produce tailor-made milk for this baby, so
Oh,
that this baby will start gaining weight. It is
yes.
more rich in carbohydrates and the fat content.
It is so wonderful to see like how nature is playing so great role.
Yes.
Like, yes, it is
Yes.
prepared in all the ways.
Yes.
Yes. Okay. We have a couple of questions more, ma'am.
Yes, definitely.
Okay. Thank you for taking it. Uh,
I'm happy about the audience response, very enthusiastic and energetic. I
yes,
would
yes.
love to answer these questions.
Okay, ma'am. So, why axillary pain occurs, ma'am? Like, is it referred pain due to like breastfeeding?
Um, as I was discussing regarding lymphatic drainage,
Mm-hmm.
the fluid gets collected under the watery content that is there in the breast lumps when the engorgement is there. The fluidy content gets gathered under the armpits. That
Okay.
is why it becomes very heavy over there. You can even see lump kind of thing over there. Lymphatic drainage is going to help with this relieving the lump from there.
Okay. For that, can we do like gentle arm exercises, hand
Uh,
exercises?
Obviously, massage and exercise will help.
Okay, ma'am.
Mm. Sometimes mothers are not able to lift the hand up because it is caught over here. It is heavy.
Okay, okay.
Right?
Yes, ma'am. Yeah, I think we are almost done.
Mm.
Yes. Uh, there's someone who was raising their hand. Okay. Her doubt is also clear, it seems. I want to just read one message for you, ma'am.
Please.
There was someone who was telling me it is so good to see you speaking it since. That is just specially for you. I want. They were like
Thank
telling,
you.
it's a thank you IAP team for conducting such a good webinar, such an eye opener session. It seems. And there was someone who was like, they said, nice to see you, Dr. Vinoda, ma'am.
Okay.
Okay. So I think these are small things which make us feel happy, like after
Definitely.
taking some sessions like this. Yes. Okay. So I shall proceed with the vote of thanks. So, on behalf of Indian Association of Physiotherapists, Women's Cell Telangana, I would like to take this opportunity to extend my heartfelt gratitude to who made this today's webinar on prioritized breastfeeding, creating sustainability and support, organized especially during our breastfeeding week, the sounding success. So, first and foremost, I sincerely thank our distinguished speaker, Dr. Vinoda ma'am, uh, woman self physiotherapist, for sharing her invaluable insights. Yes, ma'am, it was definitely invaluable and deep knowledge on such an important and impactful topic. Your expertise and practical guidance have truly enriched us, ma'am. Thank you so much.
My
And my special, well, thank my special thanks to our moderator, Dr. Praharsha, obstetric physiotherapist, for smoothly guiding today's session and also ensuring it remained interactive and engaging also. Thank you, ma'am.
Thank you,
I
Dr.
would
Reshmi.
Thank you. We are grateful to our leaders for their continuous encouragement. Dr. Sanjeev Jha, IAP President, Dr. Ruchi Varshini, National Head IAPWC, Dr. Jayaprabha, South Zone Head IAPWC. A heartfelt thanks to our State Head IAPWC, Dr. Madhuri Ma'am, for your constant support and motivation for helping us to organize this wonderful webinar. Thank you, ma'am. A warm appreciation goes to the Mechal Malkajgiri district team and also the organizers also, whose dedication and hard work ensured the smooth execution of this event. Thank you. Thank you, Vaishali ma'am. Thank you, Vedvani ma'am. And also thanks to me also.
Thank you, Dr. Reshmi. That was really wonderful, the Q&As and the way you carried it forward. And thank you so much.
Thank you, ma'am. Finally, I would like to thank our wonderful team as well, Dr. Atia ma'am, Dr. Asha Susan ma'am, Dr. Shravanti, Dr. Lakshmi Prasanna, Dr. Ranjita, Dr. Nisiraj, Dr. Vandana, Dr. Monica, and also Dr. Anuradha. And most importantly, to IAP Digital team and especially Dr. Heta for always for constantly giving us the support throughout the webinar. Uh, yes, last but not the least, I would like to extend my gratitude to each and every participant and listener, and the special who raised their queries also. It takes courage to put the questions also in the question box. I know that. Your active involvement and attention made this session more meaningful. Thank you. We hope you all found this session informative, thought provoking, and inspiring, and that it will also help us in advocating and prioritizing breastfeeding, and as it is a cornerstone of maternal and child health. Thank you once again, everyone, and we look forward to your presence in our future programs as well.